No viewer will need reminding about how urgent the procurement situation was at the onset of the COVID-19 pandemic, and indeed the frantic scramble that there was for the likes of respirators and personal protective equipment from the HSE at a time that they were trying to ensure the safety of patients and of staff in the acute healthcare settings. One purchasing agreement that was entered into around that time concerned the use of particular sensors that were used for respiratory patients, including those that had COVID-19. Now, this particular sensor that was procured at the time by the HSE had the advantage of being able to be monitored remotely, which is a particular advantage to staff in the health service because it meant that they were able to monitor the progress of patients with COVID-19 or other respiratory conditions without needing to come into face-to-face contact with those patients. But because of the urgency of the circumstances, what effectively arose is that the HSE was making renewed orders for those sensors, one per quarter, at a cost of €900,000 per quarter, in other words €3.6 million a year, without there being a proper log of how many of those sensors were actually being drawn down from the company. And as it turns out, the HSE said some hospitals liked the sensors, others didn't think that they were worth the particular hassle, but the HSE nonetheless was paying for sensors that the hospitals were never actually drawing down from the supplier. The HSE's chief executive, Bernard Gloucester, has been explaining.
The gap between who was signing the invoices and the actual utilisation or any checking of it was so far apart as to be absolutely inexplicable. And there's no point in me trying to dress that up any other way. That it was one of the most defining collapses of corporate governance that I could see.
This particular...
Yes. Well, this was extreme. Not because it happened once, but because of its continuance.
Now, Bernard Gloucester did go on to say that that was a relatively novel procurement process for that particular product. It arose out of the urgency of the COVID-19 proceedings, but that the similar systems were not in place for logging the use of other products that had been procured by the HSE before and after the pandemic. Separately, Mr Gloucester was also asked about staffing at Children's Disability Network teams, CDNTs, which you know has been a major political talking point over the last number of years and was a major issue in last year's general election. He conceded that although the staffing situation in those CDNTs with the hiring of therapists is better than it was 12 or 18 months ago, that the HSE would face difficulty next year in continuing to recruit the likes of speech and language therapists, physiotherapists and occupational therapists for those teams. The reason being that those sorts of therapists are also being recruited elsewhere across the public health system, and in some cases it simply isn't attractive to be able to recruit them into Children's Disability Network teams. So although the money is there to try and recruit them, there is an overall staffing shortage, and the HSE is in competition with itself to try and recruit those people to fill those vital gaps.